over to Dr. Herman to get us started. Take it away.
Okay, well, thank you so much, Hannah, and thank you to ACNJ for having me. Thank you to Mary Coogan, and thank you guys so much for including oral health in the last Trenton Kids Count. So we really appreciate it, and any help we can get in a collaborative effort to expand access to oral health care in the state would help us. So my name is Dr. Michal Herman. I'm the COO of KinderSmile Foundation. So this presentation is pretty big. So there's a lot about KinderSmile Foundation and then a lot about what we need to do to care for our own and our children's oral health, as well as the barriers and access to oral health care in the state and things that we together can help advocate to change in order to expand that access to care. And here we go. And I can't, oh, here we go. Okay, so the mission of KinderSmile Foundation is to provide underserved children with access to comprehensive dental care and educate children and their families about the importance of dental hygiene. We envision a future where every child has access to a dentist and preventable dental diseases are eradicated. KinderSmile Foundation was established in 2007 with values of education, intervention, and prevention. And by now, in the last 16 years, we have provided over $12 million of in-kind dental services and impacted over 47,000 underserved patients in New Jersey and 10 locations across the globe to prevent the #1 epidemic for economically disadvantaged children. These are our 4 main programs. So our KinderSmile Oral Health Program, our KSOHP program, is our premier program and the program that we started the foundation with. So in 2007, we started the foundation with just this program. We did not have dental homes at the time. So this program is where we go to schools and community centers and provide oral health education and preventive dental care for children at their school, meaning that they're not going to miss school days and the parents are not going to miss work days in order to get that preventive care. And then we immediately link them to our dental homes for comprehensive care if they need it. Our perinatal health and wellness program breaks the dangerous cycle of untreated dental disease for pregnant and recently postpartum moms. So uninsured mothers from pregnancy to 3 years postpartum are qualified for this program, and we provide 3 hours of oral health education for them to care for their own and their baby's oral health. And then we link them to our dental homes and they receive a year of free dental care in our dental homes. One of the things we started doing this year with our new director of the program is to also offer this program to Medicaid moms. So Medicaid moms can get dental care under their Medicaid, but this will provide them that 3 hour of education so that their children could have better oral health, and so can they, and then they can get their oral health care at our dental homes under their insurance. Our Give Back a Smile program offers licensed dentists and dental hygienists the opportunity to donate their services to uninsured and underserved children in New Jersey, offsite and in our dental homes. And our community service learning program is where we offer mentorship and shadowing opportunities to students from high school to postgraduate school. And often these students are either pre-dental or pre-public health. And you know what I always try to instill in them is my passion for public health and how much I want them on the other side to either join public health dentistry, or even if they go into private practice, donate at least some hours of their month to underserved or uninsured children. Our dental homes. So the foundation was born in 2007, and then in 2016, we opened the first dental home in Bloomfield, New Jersey. In 2019, we opened in Newark at the Boys and Girls Club of Newark, within the Boys and Girls Club of Newark. And in 2020 in Trenton, where we offer full comprehensive care to children and adults alike. And in 2023, we provided over $6 million of comprehensive care. So barriers to access in oral health care. So to achieve health equity, barriers must be removed and social determinants of health must be just. And this is Obviously not just for oral health, but this is what I'm talking about, but this is, across the board. These are things that people have trouble with. So insurance status or lack of insurance coverage for dental care, lack of providers willing to accept either very young children or those who require additional time, either for different reasons, including developmental disabilities, or behavioral management needs, lack of transportation or childcare, lack of convenient hours for working parents, language barriers, fear of the dentist, but aside from that, fear due to immigration status and fear due to discrimination bias related to racial or socioeconomic status. And these are some of the barriers that we try to eliminate either with our programs or in our dental homes. So due to inequities in oral healthcare access, disparities persist for children living in poverty and for some race and ethnic groups in the US. And the prevalence of untreated decay is much higher for Black and Hispanic children than for non-Hispanic white children in America. So although Medicaid offers dental coverage for children, only 13%, this is in New Jersey, only 13% of eligible one-year-old children received preventive care. I think this is 2021 data, and only 38% of children aged 2 to 3. The demographics that we serve at KinderSmile Foundation, so over 93% of our patients are either uninsured or insured by Medicaid, with less than 7% having private insurance. And similarly with Black and Hispanic, we are nearly half and half Black and Hispanic, with less than 7% non-Hispanic white children, or patients, I should say. Same, this is just a visual of what that was. And then a little bit about oral health and nutrition. So this is something we do at KinderSmile Foundation at every single visit. So Chance and Mario would know that they go to the toothbrushing station every single time that they come into the dental home, whether it's for an emergency, for cleaning, for a recall exam, for a restorative visit, anything they do. They always go to the toothbrushing station. They get their education from either a dental assistant or a volunteer, and they get their 2 minutes on the clock, and always education, intervention, and prevention. So with repeated oral health education and routine access to care, we strive to improve the oral health care of at-risk youth from age 1 or the eruption of the first tooth. So even if they're 6 months and they have their first tooth, we want them to come in. We concentrate on value over volume. So this is one thing about KinderSmile Foundation, is that a lot of people think that we're an FQHC. We're not. We're not an FQHC, and we're not a Medicaid practice. Our dental homes look as much like a private office as any, colorful, beautiful, clean places. We spend quality time with our patients. We spend 45-minute appointments. We don't get the state or federal funding like FQHCs do. We are based, about half of our sustainability is from private grantors and donors, which is a little bit of a lot of why we're doing the advocacy that we've been doing in the last few years, is because it's hard to think that in New Jersey, children need to rely on philanthropy in order to get their access to care. So that's that. Okay, this is more about oral health and nutrition. These are some of the materials that we pass around in different languages. And same with the schools and community centers. We always do oral health education. And this is a little bit about what you guys can do for yourselves and for your children. Is always the rule of 2's the optimal guide. Is brush your teeth 2 times a day with fluoridated toothpaste. Fluoridated toothpaste is now recommended, since we don't wait for the age of 2 for fluoridated toothpaste anymore. So from the start, this is what you need to do. Brush your teeth for 2 minutes each time and visit the dentist 2 times per year. And I know the rule of 2 doesn't include flossing, but I do recommend flossing every day. And then let me just say that without doing all this repeated oral health education every time, this is what we get into, which is the vicious cycle of lack of access to oral health care and the vicious cycle of not knowing, just not knowing about oral health as much as it's linked to total health and well-being. So this starts with the mothers. So I don't want to do too much when we look at this cycle because we're going to go into this more in detail in the next slides. But if the mother doesn't know the importance of caring for her own oral health and her baby's oral health, then when they're infants or babies, they're going to have early childhood caries, which is very prevalent in the United States, especially for Black and Hispanic children. And then when they're toddlers, they're going to start prematurely getting their teeth extracted. And then when they're young children, they're going to pronounce things differently. They're going to be placed into special education because of speech, what is perceived to be speech impediments, when really it's because of prematurely extracted teeth. They're going to lose a lot of school hours as school-age children. It's going to affect their mental health, self-esteem, confidence, and then it's going to affect their ability to seek a job and maintain a job due to either confidence because of the way their teeth look or misconceptions because of the way that their teeth look. And this is our vicious cycle. Starts with our moms, with our matriarchs. This is a 25-year-old woman who was just at our dental home 2 weeks ago. She's a part of our perinatal health and wellness program. And by the time that her baby is born, she's going to be a 25-year-old mom with dentures. So maternal periodontal disease is linked to preterm birth and low birth weight. Although we know that periodontal disease during pregnancy has been shown that the treatment of periodontal disease during pregnancy has been shown safe and effective. So it used to be that during pregnancy, you were asked to wait for non-emergency dental visits. Now we recommend getting your dental care regularly during pregnancy in order to save some of this from happening. So we know that pregnant women with chronic periodontal disease are up to 7 times more likely to have premature births than those without. And that's one of the things that we try to do with our perinatal health and wellness program, with repeated education to improve some of the maternal outcomes that we have in New Jersey. We know that 60 to 75% of pregnant women have gingivitis, which is an early stage of periodontal disease. So anything that we can do to help these moms and educate them about early childhood caries. And this is what we see in these are our real patients. This is what we see right here in New Jersey. These are all teeth that, not all of them, but many of these teeth are teeth that have to be very prematurely extracted. And just, I hope you can imagine the pain that these kids are going through, and they don't even know how to express it necessarily. So early childhood caries are much more common in racially, ethnically, and socioeconomically, historically marginalized communities, although they are preventable with continued education and timely access to care. So premature extractions in children can lead to long-term speech and pronunciation differences. And early childhood caries in the United States is 24 to 28% in prevalence, which is a lot. These are some of the ways that we can decrease the risk for some of these caries. One is very important to establish a dental home by the age of 1 or the eruption of the first tooth. We want to eliminate sugary foods and drink. So we try to say it gently, but to eliminate the baby bottle and breastfeeding after 12 months, eliminate 100% fruit juice before age 1, encourage water drinking, and avoid sugary food, and then implement early oral hygiene measures, which is right away as soon as the baby is born, to wipe the gums, either after feeding 2 times a day or at least before bedtime, and implement that as a bedtime routine. So you take either a wet finger, a wet cloth, a washcloth, a towel, a piece of gauze, and you wipe those gums even if you don't see teeth, even if it's just for routine, but even as the teeth are developing under the gums, as soon as they start peaking, they're they're very tiny and they're very sensitive to that. So toothbrushing, as soon as you start seeing those teeth, by a parent or caretaker. So ideally, until the age of 8, you still need to help your children brush their teeth twice a day. So you let them brush and you follow right along after. And use of toothpaste with fluoride, a smear under the age of 3 and a pea size from the age of 3 and up. And receive professional preventive dental care. So go to the dentist twice a year as soon as the baby has a tooth, and medical dental integration in order to, for pedodontists, for periodontists, for pediatric regular doctors, for nurse practitioners, everyone, teachers, everyone can to educate the parents and the children about oral health and help us educate parents, caretakers, oral health professionals, medical professionals about early childhood caries and the effects that they can have on children in the long run. Support community water fluoridation. So we're going to talk about that a little bit later, but New Jersey is ranked 49th in the country in water fluoridation. So most of New Jersey does not have fluoride in the water, which has been shown to be not poisonous in the amounts that they add, but is very helpful to prevent oral disease. Raise awareness among legislators, policymakers, and third-party payers about early childhood caries and the need to expand access to care for all. And this is what we've been doing, and I know ACNJ has been doing for a long time. So advocate for improved reimbursement systems to allow access for all children. So there's a lot in that slide. So then you go into school-age children, and school-age children lose 34 million school hours each year due to dental problems. And children with poor oral health are nearly 3 times more likely to miss school than those without, and have been shown to have lower school performance. So poor dentition, such as missing, discolored, broken teeth, can lead to behavioral, cognitive, social problems, depression, low self-esteem, social anxiety, shame. And in the last year, New Jersey collected and published data, oral health data, for the very first time. So now that we've had a state dental director for the last 5 years, we started collecting data for the first time about oral health. And we know that 36% of all New Jersey third graders have untreated dental disease compared to the national average of 20%, which is a lot. And on any given day, 15% of New Jersey's third graders need urgent dental care. And then as the kids get older, it affects mental health, the workforce, incarceration. So 30% of people entering the workforce aged 18 to 34 state that the appearance of their teeth prevented them from successfully seeking or interviewing for jobs. And we know that they are less successful in advancing their careers due to negative associations with missing or discolored teeth. And the WHO, the World Health Association, has found that a high prevalence of dental caries and periodontal disease, as opposed to the other population in people who are incarcerated. So patients are more likely to engage and trust dental providers who look like them or share their culture. Dental providers who are relatable instill a higher level of compliance and reduce dental fear and trauma. So this is one of the things that we try to do with our community service learning program as well, is to, and with other workforce development programs that we have, is to diversify the dental workforce. So we know that Black patients have been shown to be more likely to be treatment planned for extractions rather than for root canal therapy compared to their counterparts. So, which is, it breaks my heart, actually. So we definitely need, so we know that Black dentists right now are only 3.8% of the population, as opposed to 13% of the population that Black people are in the United States. So we definitely need to do a lot more. So also collecting data about the diversity of dental providers and dental providers who accept Medicaid. This is one of the things that we asked the state to do as well, is to collect demographics data for providers participating in Medicaid in the state. So mentorship and internship opportunities in low-income communities can also help increase the diversification of the dental workforce and the dental workforce itself, even to just give them the opportunity. So oral health is the gateway to total health and well-being and affects systemic things such as diabetes, heart disease, respiratory infection, dementia, job success, physical and systemic success, school performance, mental health, self-esteem. It affects everything. So maternal periodontal disease, again, is linked to preterm birth and low birth weight, and high level of cardiogenic bacteria in pregnant moms can increase the risk of dental caries or dental cavities in infant and children. We know that oral cancer is the most common head and neck cancer and can be early detected and improve outcomes with regular dental visits. But if you don't have that link to a dental home or the ability to have dental insurance in order to have that link to a dental home, that's very difficult to do. And then severe oral infections can affect overall health up to and including death. And KinderSmile Foundation was established in 2007 following the death of this young boy, Diamante Driver, who was 12 years old in Prince George's County, Maryland, and unfortunately died from a tooth infection that traveled to the brain. And I start crying every time I talk about this, but you know, this is real. This is real. This is real, you know, and this is why we do what we do. And this is why we need to expand access to care so that in New Jersey, we don't have this similar case. So when you don't have access to a regular dental home, you go to the emergency visits, to emergency rooms, and emergency visits to the hospital to address dental disease cost the taxpayers an average of $749 for a total of $2 billion per year in the United States. And that would be for basically just to go there and basically get a prescription and try to find a dentist who can help you afterwards. So it's not even definitive care. So if everyone had that access to care, then we would be able to save New Jersey taxpayers a lot of money. And these are some of the things that we've done. In 2023, we've provided over $6 million of care, and over $2 million of that was in-kind donated care. So we provide a crucial link to a permanent barrier-free dental home in our dental homes in Bloomfield, Newark, and Trenton. In 2023, we had 41 community service learning program volunteers who donated nearly 2,000 hours of their time in clinical, administrative, public health, outreach positions. We also had Give Back a Smile professional volunteers, dentists and dental hygienists, who donated nearly 300 hours of their time. And in the last 16 years, we had over 300 CSLP volunteers who donated over 16,000 hours, and over 70% of them have been accepted to dental schools. Our perinatal health and wellness program has provided education and free care for a year for 363 perinatal mothers and counting since the start of the program. And our continued efforts in dental workforce development in the state through partnerships with dental assisting, dental hygiene, and dental schools is a way that we try to develop the dental workforce and diversify it. And our programs, our KinderSmile Oral Health Program, KSOHP, and Perinatal Health and Wellness Program include large sets of data collection to be able to help the state collect data in order to improve children's oral health and maternal health outcomes for Black and Hispanic moms in New Jersey. And then we couldn't do anything that we do without our community partnerships. And that includes schools, early Head Starts, early Head Starts, public and private schools, community agencies, networks to advocate for oral health equity, such as the ACNJ, agencies with mutual partnerships to cross-refer families in need of services, workforce development, statewide agencies, hospitals, FQHCs, and many, many more. And we are grateful that New Jersey has taken some strides and has done some progress, but there's so much more to do. So the appointment of a state dental director within the Department of Health in the last 5 years has been very helpful. And we've gotten a lot of work done with it, but there's so much more to do. The expansion of Medicaid to cover all children, all qualified children, regardless of immigration status, has been very helpful. This has been since 2023. The applications for HRSA grants, these are federal grants related to oral health care. And that was also because of the state dental director and Nashon Hornsby and the Department of Health. The creation of the first oral health plan, which is pending approval from the governor, the inclusion of dentists in state and federal loan redemption programs. So this is one of the things that we're very grateful for, because dentists graduating from dental school these days are graduating with nearly or more than $500,000 in loans. So for a public health center like ours to try to compete with private dentists or with dental service organizations, which are corporate dental offices, in terms of salaries is impossible. So the loan redemption programs are some of the ways that we can offer help. And then the roadmap to improving oral health access in the state of New Jersey, what I show here is just a very, very small portion of what we introduced to the state this past year, as we advocate for expanded access to oral health care. So Medicaid coverage is intended to place members in the same position of having access as the rest of the population. But unless you have enough providers to provide that care, that can't actually happen. So these are some of the ways that we can do that is to add a line item in the state budget to support oral health, to mandate the oversight and regulation of New Jersey's 5 managed care organizations, which are the companies that carry out the New Jersey Family Care or Medicaid. And these are some of the things that we want them to do, is to regulate reimbursement rates so that we, as providers who provide care under Medicaid, get the Medicaid fees that New Jersey actually approves, and not a small fraction of it. We actually get only 46% of what New Jersey actually approves. To mandate the participation in all 5 MCOs. So there are providers who choose only the higher paying MCOs and not the lower paying ones. To expect them to accept all children from the age of 0 and not from the age of 5 and 6. To require provider directories to be updated regularly so that patients don't have to sit there and call provider after provider to look for someone who actually accepts their insurance and not just listed as accepting their insurance. To improve the quality measures to reflect value over volume and not just very speedy visits where they do 1 procedure per visit, but spend time with the patient and eliminate some of so what we do is we call it quadrant dentistry. So we do a few different procedures per visit in order to save some school visits or some school absenteeism and some work absenteeism for the parents and children. To request a prompt credentialing so that providers who are willing to accept Medicaid don't have to wait 3 months to be able to actually see patients, but can see patients much more rapidly. To provide more incentives for providers to join public health dentistry. To permanently fund a dental director and staff in the Department of Health. So yes, we're very, very grateful that we had a dental director, but he was supported by a grant, and we would like to see a state dental director supported by the actual New Jersey state budget. Mandate dental screenings for all children from the age of 2 to 12 prior to starting school, so that we can avoid some of the carries that we saw from advancing to the state that we saw them in, and that maybe we can treat them when they're early on in their disease. reproduce our perinatal health and wellness program. This is actually a pending bill in the state Senate right now to expand our program in partnership with the Department of Health and with the 3 maternal consortia in New Jersey, so that we can educate more moms and improve their oral health and their children oral health for long-term improvement in the state, and include oral health in the Medicaid expansion for maternal care, and regulate water fluoridation in the state, which is again ranked 49th in the nation in in water fluoridation. And then in conclusion, we at KinderSmile Foundation bridge the gap in access to oral health care and raise awareness of the importance of oral health to total health and well-being. We continue initiatives related to oral health, and we are very grateful to all of our partners, and we need to all work together to prevent a tragedy from happening in our own garden state. And thank you. And then this is one more thing that I'm going to say is that this past year, aside from doing the roadmap and introducing it to the state, we also produced a documentary with real life stories of our patients, staff, oral health advocates, some legislators. Mary Coogan from ACNJ is actually in this film. And this film was selected to show at the Garden State Film Festival, and it will show on March 23rd at the 12 p.m. block, and we hope to see some of you there. And thank you. You're muted.